7th semester nursing student. Today is September 25th, 2018, and the time is 13:30. Today I'm gonna show to you how to insert the NG tube, how to um, how to administer medication through that NG tube, and then later on I will show to you how to remove that NG tube. First of all, we'll start with the NG tube and then we'll progress as we go along. Um, to insert an NG tube, I'm gonna go ahead and assess my patient as far as the nose patency, making sure that there's no symptom deviation. I'm gonna go ahead and check for any medical history of nasal surgery, and also I wanted to make sure that the mental status of my client as well as the ability of my client to be able to cooperate while I'm doing this process. Because definitely I'll be needing his cooperation while I'm inserting it too. Also, there should be an order to insert an NG. Now that I'm done with my assessment, and oh yeah, before I forget, you could also assess your client's nasal patency through checking the nostrils using a pen line just to make sure which side of the nostril or which side of the nares you're going to use. And after the assessment, I'm going to go ahead and gather all the necessary supplies for the procedure. I'll have the sewing soap, the tube that I'm going to be using, the lubricants to make it smoother when I insert it, clean gloves, some pH paper to be able to test for the gastric pH or pH of the stomach, and then some tape. Tape is very important. I already have pre-cut it, 3 different types of tape that I will be needing, and I will be explaining that in a little bit. Also, I need to have some piston or 50 ml syringe. I might need a towel also, and water with straw. That's the most important thing. Now that I have that ready, all this materials needed, I'm gonna go ahead and go to my client's room, do hand hygiene, provide privacy, and then go ahead and introduce myself, and then verify my client using 2 patient identifiers. What's your name, sir? Your date of birth? Okay, that's correct. And then I'm gonna explain the procedure. What I'm gonna do is I have an order for you to insert an NG tube. What I'm gonna do is insert the tube through your nostril, one of your nares, and into your stomach. It's just to help you on your nutrition, your feeding. Okay. Do you have any questions so far? No. Okay. Let's go ahead and start. I'm gonna go ahead and position my client to high Fowler's position, almost to a sitting up like position. Just this will supposed to facilitate easier insertion process. And then the height of the bed should be on my height. And then now that I have that, this towel is just to make sure that no splashes everywhere. Sorry if you have any question as I insert your tube, or you have difficulty, you're hurting, you're in pain while I'm doing that, let me know, and then we'll stop the procedure, okay? Alright, then put on my clean gloves. This is a clean process, so I'm just gonna be using clean gloves. And then with this tube, I'm gonna go ahead and measure from the tip of the nose to the tip of the ears and to the xiphoid process. This is how far I could insert this tube to make sure that I'm in the gastric area. Right now it is 44. So then I'm gonna go ahead and put the tape on. That will just be my mark. Just to remind me that's how far I'm gonna insert this tube. 44. After that, I'm gonna explain to my client that when I'm gonna insert it, you have to swallow, sip and swallow, okay? Like this. Then I'm gonna lubricate the tip of this catheter up to 4 inches at least. That's water. We're supposed to do this, but for demonstration purposes, I'm not gonna do that. It's a little heavy for this mannequin. So after that, have that ready. I'm gonna go ahead and insert it. To do that, I've determined that the right nares is the most patent and okay, so I'm gonna insert it. Hyperextend, sir. You hyperextend your head for a minute, and then as soon as I hit the oral pharynx, oral pharynx, I'm gonna allow my client to just bend the neck or chin to the chest kind of position. And after that, I'm gonna instruct my client to swallow, some sip and swallow. And each swallow, it should be, with each swallow, I'm gonna advance 2 more inches. And also I'm gonna rotate it to where it wouldn't irritate, or it wouldn't be dislodged on the esophageal area. Okay. Since this mannequin does not really allow you to insert all those things here, sometimes it is wise to check, because at the back, behind the throat, sometimes this tube will gather behind the throat and it won't let you. But this one is just not working with swallowing. He's helping me swallow, it's not working. So let's pretend that I've already reached this point, okay? Then I'm gonna temporarily put a tape, just so it won't excuse me just so it won't fall off as I'm gonna go ahead do the check. It is important to do the check the placement of the tube, just to make sure you're not in the lungs or you're not in the intestine. Well, in the lungs, pretty much. To do that, there's 3 ways. One, the most definitive one, is the X-ray, and then the second one that we have on hand right now is check the pH, the gastric contents. To do that, what I'm gonna do is attach this piston plug, aspirate some low gastric contents. As soon as you got one, you test it using the pH that we have right now. Whatever the pH 4, that's what we wanted. It's just saying that you're aspirating a hydrochloric acid. Beyond that, you might be in the lungs. You don't want to do that. The other way to do that also is to listen to this whooshing sound. If you instill some like 30 ml of air, to do that, you do it this way, and then you, right in the epigastric area, you push and listen to the whooshing sound. And in this case, I did hear the whooshing sound, and my pH is 4. I'm in the stomach area. So after that, now that I'm gonna secure this using the pants tape that's already been prepared. Just put the pants tape that way, and then other way, making sure that it's secure. And it's also important to tape this, or you could use some pen. A lot of the facility would use pen and attach it to the patient's gown while making room for the client to be able to turn and not pulling this tube, okay? Okay, well, after that, I'm gonna go ahead and document the procedure, the size, and the size of the and the type of the tube that I've inserted, and then how was the client tolerated the procedure, and maybe the gastric contents that I have aspirated, the pH. And now I'm gonna, this time around, then throw it in the trash, wash my hands. This time, I'm gonna go ahead and administer a medication through the tube. I've already prepared the tube. I've already prepared the medication, but pretty much you have your order. You determine what you've done your checks, medication checks. If you determine whether the tablet can be crushed or cannot. The enteric coated, most likely you're not gonna be crushing that. I mean, some tablets are not allowed to be crushed, so you're not gonna do that. But in this video, I've already crushed my tablet and mixed it with 20 ml of saline. I mean, sterile water, and then I'm gonna. Then these are the medications that I've prepared. I have total of 3 medications. But the most important thing prior to instilling the medications per tube, you have to check the residual. Some residual would be more than 200 ml. Most likely you return that you're not gonna administer the medication just because it's telling us that the patient is not digesting those feedings. And then after that, it was also important to check the placement prior to administering medication. You just have to check the mark, and if it's not in the proper placement, you just kind of push it to where it would reach the stomach anyways. Now that I have checked everything, I'm gonna show you how to instill medication per tube. To do that, take gloves. Then, using the using the barrel of the syringe, I'm gonna go ahead and attach this to this, leaving this vent open anyways, and then you kink. Almost every single time before you pass medication, you have to instill the water or still water, just so it will clear the tube. And in this case, it is not, something's wrong about this tubing, that it's not, even though with the gravity, the higher you get, it's supposed to be faster, but it's not moving at all. But you get the point that I would instill water just to clear the tubing, and then I would still the medication, and then I would still the water again. So in every medication, you just gotta have to instill water between medications. Okay, now that I have that, I'm gonna go ahead and after I clear, okay, I pass all my medication, all right, and I already put in the water just to clear it, and that is just, then I would document the procedure and all the medication that I've given, and just to make sure that, one thing though, after giving a medication, you have to wait 20 to 30 minutes before you turn the suction back on, and also prior to administering this medication, you need to turn off the suction. And after giving the medication, turn the suction back on, and make sure it's like that. Then document procedure, take off these gloves, Now, in this time, I'm gonna go ahead and remove the NG tube. I have an order to remove it, so it's about time. Patient is ready to go home. So what I'm gonna do is assess, make sure that the last feeding was like 20 to 30 minutes ago prior to even removing the NG tube. After that, I'm gonna go ahead and flush with water or air. And in this case, just to clear the tube. In this case, since our tube is not flushing, I'm just gonna go ahead and flush 30 mils of air. Just so when we take that tube out, it won't be splashing everywhere. And then I'm gonna instruct my patient to take a deep breath, sir, while I'm pulling it out, okay? You're good to go, you're ready to go home. So so it won't be splashing everywhere, do it like that. Oh, that was a splash. That's what we're trying to prevent. And then take it up, throw it in a trash, make sure patient is comfortable, document the procedure, and how was the patient was tolerating the entire thing. All right, that's how you do it. Thank you.